Good evening, and thank you for joining us. I'm Deborah Livingston, and I'm a director with the Mayfield Education and Research Foundation. Welcome to our first installment of Spine Talks, our new webinar series created to improve your spine health. After this evening's program, we will continue this series with a new topic each month and encourage you to register for them at any time. Tonight, I'm happy to moderate this webinar, The Best Exercises to Protect Your Back, with Mayfield physical therapist Jenna Till. Jenna is a physical therapist with Mayfield Brain and Spine and practices out of our Northern Kentucky office. Thank you for being here, Jenna. You may now begin your presentation.
Thank you, Deb. I appreciate that. Tonight, we're going to be talking about 4 different topics with the main goal of giving you the tools to protect your back. The first topic that we're going to cover are anatomy and conditions. If you look at the spine pictured in front of you, you see the spine from the side. The top 7 vertebrae are your cervical or neck vertebrae. They allow for flexibility, checking your rear view mirror, doing everything you need to do with your neck. The 12 thoracic vertebrae, your mid-back, attached to your rib cage. So they have limited motion because of all of those joint articulations. And the 5 lumbar vertebrae that you see at the bottom are the larger ones, so they allow for increased weight bearing. Last but not least is the sacrum. This connects to your 2 hip bones. From the front, you can see the sacrum at a better angle. You see how it attaches to, again, the 2 hip bones, and that is called your sacroiliac joint, or your SI joint, as I'm sure many of you have heard of. Here is a picture of the vertebrae at a closer look. On the left, the side view, you can see the disc in between. It looks kind of purple in color. You see the vertebrae bone. And then on the right, looking from top down, an aerial view, you see the nice bony matrix covering that hole, and we'll talk about that later. But in this picture, you can better see the disc. You see the outer annulus layer and the inner nucleus gelatinous material. It's almost like a jelly-filled donut, with the jelly being in the middle. Here is the same picture, but now we're going to talk about the holes. On the left, you see the nerve canal where the nerve roots exit. They exit on both sides. And then on the right, the reason I mentioned that bony matrix surrounding that hole is because that provides protection to the spinal cord, which is very important. Here is the same picture, but this time with the nerves inserted. You can see how that spacing is going to be very important for your nerve health. On the far left, you see the spinal nerve roots, the foraminal nerves, and then on the right, you see the spinal cord. This picture depicts your facet joints. That is what allows you to side bend left to right, rotate, bend forward, backwards, everything you need to do to get from A to Z. Those facet joints are kind of like your knee. They allow you to do different kinds of motions. Now we're going to start to talk about conditions. What happens to the spine when it's under duress? This one is called degenerative disc disease. This is where the discs dry out. You can see the disc on the far right, how it brings the 2 vertebrae closer together. And when you approximate those 2 joints closer together, you can see how other segments are going to be affected as well. You can see how the facet has become very irritated. And then you can also see how the space where that nerve root comes out is also closed down. Nerves really like space. So when you interrupt that, you can start to develop symptoms. Spondylolisthesis. This is where one segment is too far forward or too far backwards. It's called anterolithesis when you go forward and retrolithesis when you go back. But basically, this is an unstable segment which can create a quote-unquote kinking of the spinal nerves and create symptoms for you. Here is a picture of the herniated disc. You see how the gelatinous material, or that jelly part of that donut, has actually extruded out and hit the nerve root. This can obviously create symptoms for you going down the leg. Here's a picture of a bulging disc. So in this, you're still hitting that nerve root, but that internucleus has not exited out of the annulus yet. Both of these can be just as symptomatic as each other. It just kind of depends on what it's hitting and to what extent. You could actually have a bulging disc come out another location, but if it's not hitting any nerve roots or any offending structures, you may not even have any symptoms. Here is spinal stenosis. Stenosis means narrowing, and you can have narrowing wherever there's a hole, basically. Foraminal stenosis is when there is narrowing of the foraminal nerves, the ones that exit out the side. Central stenosis is when there's narrowing in the middle. This is a picture of different variations of scoliosis. On the far left, you see the normal picture, and you see the plumb line or the center of gravity in the middle. On the far right, you see how the curvatures of the spine are getting away from that line, and that's going to begin to put stresses on different places that aren't used to receiving stresses. You see the scoliosis, the first one, that is a lateral curvature. The next one says kyphosis. That's where the flat back is behind that center of gravity, and then the sway back when it's come too far forward. Osteoporosis. Many have heard of this, osteopenia being the precursor to osteoporosis, but you see the normal bone where you have that nice inner matrix, all that blood flow, the bony formation looks great. The one below that, you see where it has become more brittle, less bony matrix to protect you. And this can set you up for that third segment below where it says compression fracture. Aging, what we need to remember is aging is a normal process to all structures. What do the aging effects look like on your body? As we age, your discs begin to lose some of their disc height. They lose some of their water, and that brings those vertebrae closer together. That can also approximate your facets as well. You can start to have facet joint pain, and you can start to see other types of pains in the ligaments and muscles as well because of this, this disc becoming less hydrophilic. You can also notice the osteophytic formation or the bony formation. Bone responds to stress by building more bone. It's called Wolff's Law. So in this, you can see the extra formation at the end plates of those two vertebrae and how that could also start to become irksome, to say the least. Now we're going to go to body mechanics. You're thinking, Jenna, you've just told me all these discouraging things, you know, what can I do to protect myself? And that's the real crux of why you're here today. So we're definitely going to go through different things that you may not think about throughout your day that you could do in a different way to reduce the stress and strain on your spine. Here's a picture of my colleague, Josh, getting out of his car. Quite often, we just step one leg out of the car and we go. Josh actually has turned his feet around with both feet on the ground, and he's going to stand up that way. Sometimes people say, my chair's too low, I can't turn like that. So then I would recommend putting a pillow underneath your bottom or purchasing a little swivel chair that you could buy at a Patient Aid or Walmart or Amazon. And then if you still have trouble, you feel like you don't have any leverage to get out of the car, you can purchase a car handle assistive device where his left hand is to kind of give you extra leverage. But when you put both feet out the door, it's going to reduce the stress on that back, especially the sacroiliac joint. And it's also going to be helpful for anybody post-surgical to get out of a car. If you know you're going to have surgery, I would always recommend finding a car that's a little bit higher up, but not too high up. So it's going to be easier for you to get out of the car after you've just undergone surgery. This is a great slide. Sleeping posture is very important. Your discs actually fill up with fluid at night through a natural process called imbibing. So we want to allow that to occur. We want to promote that. So on the far left, you see Emily laying on her back. She has pillows underneath her knees. The best position for your spine is going to be supine on your back with your hips at 90 degrees and your knees at 90 degrees. So don't be afraid to throw a couple pillows underneath your knees. Halfway through the day, if you feel like you're able to go lay down for 15 to 30 minutes on your back just to give your spine a chance to rehydrate, that would be beneficial. On the far right, you see Emily laying on her side. A lot of times people can't sleep on their back for any number of reasons. So the next best position is on your side, putting pillows between your knees, because that helps reduce that kinking of the nerves or side bending and rotating that we all get into while we're sleeping. Here is a picture again of Emily getting out of her bed. Most often when I talk to a patient that has just undergone surgery, they say that this was one of the most difficult things for them to do for the first 2 weeks after surgery. So practicing doing this is beneficial for anyone pre-surgery who doesn't have to go through surgery or after surgery. Whenever you can do anything as a unit, it takes away the stress on that low back. So she log rolls to the side, fulcrums her legs off the top, and then sits up. Sometimes people have issues with their shoulders when doing this, and they can't get that leverage. So another thing that you can purchase for your bed at home is some kind of handrail to stick underneath your mattress, just to give you a little something extra. And sometimes people say, I have bursitis on that hip. You know, how can I get on that hip? Switch to the other side of the bed. I know it seems so easy when you think about it, but it's just, these are the little things that kind of go a long way. Sitting posture is very important, especially for us today. A lot of us have to sit down for our jobs. So sitting as far back in the chair as you can, feet flat on the ground, and avoiding getting into that stooped forward head posture. For every inch your head goes forward, you increase the weight of your head by 10 pounds. So if you're 1 inch forward, your 10-pound head is now 20 pounds, and the neck is now accepting all of that load. When you go to get out of a chair, something, again, we don't really think about, you just go to get out of the chair, and if you're in pain, it's going to be much harder to do. So scoot to the edge of the chair, bring your nose over your toes, and stand up slowly. If this is still difficult to do, always try to find a chair that's either higher or has armrest. Here's a picture of Emily on the left, working at her computer. She has excellent ergonomics. She's as far back as the chair as she can. She was unable to reach the ground, so she's making it work for her by raising her feet up with a book. Her arms are relaxed at her side, and her shoulders are not next to her ears. She's about 12 to 18 inches away from the screen, and she's not looking up or looking down. She's looking straight in front of her. Some of us wear bifocals, and that makes you look down and then kind of have to peer up, and that makes you extend your neck, putting stress back there. So if you have a different option or a different type of eyewear that could reduce that, that would be beneficial. And some of us have to work with 2 screens. So I would recommend, instead of constantly turning your neck back and forth between the 2 screens, square up to the computer that you're working on. If you're in a swivel chair, and then square up to the other one, allow that swivel chair to work for you. On the far right, you can see Emily tying her shoe. We often just bend forward, tie our shoe, but this can create a lot of stress on the back. I'll show you in a later slide how bending forward and rotating really increases that disc pressure. So for patients who have gone through surgery, we actually can't bend, lift, and twist around that time. So bringing the foot up to you is going to put less stress on that back. Sometimes I have patients that aren't able to bring their foot up to them. So you could look into getting a sock aid or shoe aid to get the sock and shoe on, or keeping a stool next to your chair and putting your foot up on top of that, so you at least get the foot a little bit closer to you. Here's a picture of my colleague Josh practicing standing posture. Some of us are able to get a standing desk, which is excellent. And if you do, you want to make it work for you by practicing good posture while you're standing there. So his shoulders are back. You could see that if I put a plumb line straight down, his spine would look great. As opposed to the one on the far right, he kind of got into that forward head posture, that kyphosis that we showed in that scoliosis page earlier. Going to get out of a chair, if you have a walker or a rollator walker, is also important for your safety. A lot of times it seems natural to just pull up on the walker. However, that's not stable. So it's going to be beneficial to sit in a chair with armrest, scoot to the edge of the chair, and then stand up. And then once you're standing, grab onto the walker. It's just going to reduce your risk of falls or hurting yourself in any way. If there are difficulties with going up and down steps, this is for anybody that has those difficulties, but this is also for anybody that is a caregiver for somebody that has that difficulty. When you're going up the steps, it's always good to stand, if you're the caregiver, stand behind that person. If they're going down the steps, the caregiver should stand in front of them. It gives them the maneuverability to protect themselves and protect their loved one or patient. You can see that Josh is wearing a belt. It's called a gait belt. If that's needed, that's also something that could be beneficial for your loved one or your caregiver to hold on to, just to protect you and protect them. On the far right, you can see my colleague Shelly is doing the dishes. I hear quite often patients have a difficult time doing the dishes because they're getting into that slightly forward bent position for greater than 5 to 10 minutes. And they're having to go against gravity. They're having to turn their paraspinals, their back muscles on, when those muscles are meant for endurance and they're not meant for power. So a good way to circumvent that is to get into a staggered position and even open up the bottom drawer like she has done and put one foot up. It will place less stress on your back. And you could also fire your abdomen as well, kind of tighten your core, your natural core set that you have, to again reduce the stress on the back. If it still hurts at that point, I would suggest soliciting a loved one to do it for you. No, I'm just joking. Okay, for the next slide, this is truly one of my favorite slides in this presentation, and I'll explain why. On the top left, you can see the hydration versus dehydration. Hydration is a brighter blue and dehydration is a lighter blue. If you look at the bottom left of this picture, you see the 3 images of somebody laying on their back, on their side, and reclines. And all of those are bright blue. So that just goes to show you that sleeping on your back or on your side with a proper pillow usage, of course, is going to increase the hydration of your disc. I like that they include the recline picture because that's also a good position for your spine, especially when traveling. I hear a lot, you know, I've got a 5-hour trip coming up. How am I going to make it? Well, you can see that if you recline that chair, get a pillow, and you're able to be the passenger, because we don't want you reclining if you're driving, then that could get you from A to Z a little bit easier. We would also say, you know, give yourself frequent breaks throughout. Try to do some stretches while you're at the rest stops. You know, go for a walk before you go, anything to get that blood flow going. You could even do ankle pumps, and we'll talk about the ankle pumps more later. We just got to keep the blood flow going. I digress. Back to the other images on this picture. You can see on the far right the extreme example of the person lifting the weight. She's bent forward and she has this weight in front of her outside of her center of gravity, and you can see her disc pressure is greater than 450%. I mean, that's extreme, and that places you at a greater risk for injury. So a lot of times we have jobs where we have to do that all day. You know, what can we do to reduce that stress? You can see that already just by keeping the object closer to you, it dropped the 450 down to below 350. So what can we do to make our bodies work for us and not against us? Here's a picture again of Shelly demonstrating on the far right the bad position for her spine. On the far left, you can see she is in a good neutral spine alignment. She has the object close to her, and she's going to get ready to lift that object. She's showing you that she wants you to keep that object as close to your person as possible. On the far right, you can see how her back is slightly bent, and that's almost like the dishwashing position as well. That is very symptomatic for a lot of people. Here is a picture. I like this one because it reminds us that we do have to take the extra step to protect our back. On the far right with the X'd out picture, you can see her rotating. Rotating is going to put you at a greater risk for injury. By now, we all know that. So when you're putting the groceries away, instead of going from one surface to the other quickly, take the extra step. It is going to take you a couple extra minutes by the end, but take the extra step to turn your whole body to put the object down. Here's a picture of Emily. She is picking up an object. This is called the golfer's lift. Obviously, we have to pick up objects off the ground. We can't just live without picking things up on the ground. She's bringing her leg back, holding onto a stable surface, and you can see how her spine looks relatively neutral. She's in a good position. She's not bending forward, increasing the pressure on that disc. If you feel off balance when you do this, you can always look into getting a hand reacher to pick up objects or squatting down with your hips and knees. We just don't want you bending with that back. Vacuuming. Vacuuming is a big culprit to back pain. Quite often we're just rushing through it. I'm not really sure what it is with vacuuming, but you just want to get through it. I would recommend taking your time, keeping the vacuum close to you. If you have a hard to reach spot, getting close to that hard to reach spot. And if you still feel like you took your time and you're still symptomatic, break it up over a couple of days. Take one room at a time. Here's a picture of taking the dishes out of the dishwasher by Shelly. She is squatting down to use her legs to lift the object. And on the far right, you can see how she's bending too far forward to lift the object. If you feel like you're unable to squat, though, like Shelly is on the far left, I would recommend just using the top shelf only to wash your dishes. That way you don't have to reach as far down. Here's a picture of Shelly moving objects closer to her, allowing her kitchen to work for her, not against her. If you're short in stature, keeping objects as close to you as possible is going to be very helpful. That way you can avoid reaching and putting any undue stress on your back or your neck. Here's a picture of Shelly gardening. We're getting close to the end of gardening season at this time, but this is definitely something we hear at the beginning of the season quite a bit. You get out there and you just want to get the project done, the sun is shining, you're feeling great. But again, this is another classic example to take the extra step. Keep the object close to you like she is on the far left instead of bending forward and putting a lot of stress on your back. If you feel like you still can't get into that position, you could put your foot on top of the shovel and use your leg leverage instead of your back leverage. A lot of us have to joyfully pick up children. And when you do that, you have to bring, if you're able to, bring that child as close to you as possible. On the far right, you see my colleague Peter picking up his son Eli. And he has brought Eli as close to him as possible, getting ready to stand up. On the far left, it's the same example. Bring that object close to you and stand up, as opposed to bending forward and rotating. If you feel like once you begin to lift that object, it's too heavy, place it back down. Sometimes if it's a child, though, that's not an option. Here is a picture of myself driving. I hear a lot. I have a 30-minute drive to work. I just feel horrible by the end of it. So what can we do in the car to help your position? If you're short like myself, bringing your chair as close to the steering wheel as possible, raising it up, lowering that steering wheel, bringing it closer to you. All these things can help you. Even if you're not short, getting your body as close to that foot pedal as possible is going to be good. If you have disc issues or any radicular traveling symptoms, especially down your driver's side leg, by the time you're finished with this drive, you're going to have really irritated that nerve if you're as far back as you can be. So bring yourself closer and get into a better position. You'll notice my hands are on the far left in the good position, down lower. When my hands is up higher, I'm activating my upper trapezius, my neck muscles, and potentially creating trigger points, setting myself up for potential headaches later on. So these are all things that we can do, especially if we have a long drive. And then if you feel like every car seat's different, if you feel like the back of your car seat doesn't give you that nice natural low back curvature, you can even just take a rolled up towel, beach towel, and put it underneath your low back. This picture is another picture of someone reaching. It's myself, obviously, but you'll see on the far left, I'm reaching with my palm up. This actually protects that shoulder joint. You have, which is very connected to the neck. A lot of times we see shoulder and neck symptoms go back and forth. So in our shoulders, we have a greater and lesser tubercle. The greater tubercle is larger than the lesser, obviously. And when you turn your palm up, if you guys want to practice that, when you turn your palm up, that greater tubercle is going to go out to the side, and it's going to open up that space where that joint is. Just like your nerves, that joint wants space and blood flow as well. So this repetitive reaching overhead for things with the palm down is going to aggravate that shoulder. And if you have an aggravated shoulder, it may contribute to pre-existing neck symptoms as well. So good, healthy habits are always great to practice. Here's another gardening picture. I don't know if you guys are anything like me. I see a weed and I have to pull it. But it's that proverbial straw that breaks the camel's back. You bend forward once after 10 years of bad body mechanics and you rupture or you herniate your disc. So taking, again, the extra mile, getting down on your hands and knees to pull that weed is going to be good. Because let's be honest, once you see one weed, 30 minutes later, you're still pulling the weeds. So if you get down on your hands and knees, exactly like my colleague Pete is doing, it's going to take the stress off your back. You can see how his spine is in a good alignment. Golfers, whenever you go to lift your golf bag, I would always recommend keeping as close to the edge of the back seat as possible. You can see on the far right how he has to bend all the way forward and then carry that load towards him, you know, just putting it as close to you as possible and then getting into that staggered stance, ready to lift that and bring it close to your person. When you go to the salon, a lot of us don't think about this, but if you have neck issues and they're bending your head back, look how extreme that position is for that woman. That is going to light up your symptoms throughout the rest of that hour long that you're there. If your salon does carry something as nice as this, picture shown, obviously ask to use it. If they don't, and you want to still enjoy your salon experience, I would recommend washing your hair before you go and just coming with it wet. That way you don't have to aggravate any of those facets or nerves in your neck. Here's a picture of Peter sitting at a desk attending a work meeting. Whenever you go into the work meeting, try to find the chair that you feel like is going to be most beneficial to you. So picking a chair that has good lumbar support, that's cushioned, that rolls, that has armrest, allows you to get as close to the table as you can, is going to be good. Sometimes these meetings can run way longer than anticipated. So standing up, walking around, you know, excusing yourself to use the restroom, anything to take the stress off that seated position is going to be good. Groceries. There must be some kind of grocery Olympics out there where we try to pick up every single grocery out of our trunk of our car and carry it all in at the same time. Take your time, keep the objects in front of you, and avoid putting them on one side. As you can see, Peter has the groceries on one side, and that puts a lot of stress on one side of his body. Puts stress on the sacroiliac joint. They can put stress on his quadratus lumborum, which is a side muscle. And here's a picture of Peter with his son, Eli, again. You can see on the far right, he demonstrates that single leg stance that we don't like, where we just naturally get into, especially when holding a child. He's going to put a lot of stress on one side versus the other. We recommend keeping both feet planted underneath you with 50% weight between your feet, and keeping that child facing in or out close to the center of your gravity. Now we'll get into self-care and physical therapy. So If you have practiced all of those wonderful body mechanics and you still feel like you have traveling pain, severe pain, worsening signs and symptoms, numbness and tingling, at that point, it would behoove you to seek out your primary care physician or even go to the ER if it's severe enough. Another option is physical therapy. If you're able to attend, physical therapy supports your spine through different ways. Your spine actually naturally supports you through 3 different ways. First one being your spine or your S-shaped curvature. So you can see in this picture that his spine almost demonstrates or looks like an S. If our spines were straight up and down, every time you walk, it would just compound down there at the lumbar low back vertebrae, and it wouldn't travel up the spine and allow for distribution. Your disc height provides protection. That allows for shock absorption. So your disc height is very important as well. However, if those 2 are affected for any number of conditions, you may be wondering, well, what can I do? And that's where physical therapy comes into play to work on your muscular support. We have so many wonderful muscles that we've been giving to protect that spine. So what does a physical therapist do? I'm sure many of you have been to a physical therapist, but if you haven't, you're going to go into that first visit. They're going to do an evaluation on you and assess where your physical impairments are. They'll develop a catered plan towards your specific impairments to strengthen the weak muscles and stretch the tight muscles. They're going to give you a home exercise program, because a lot of times we're wondering, I have all this pain, but I don't even know where to start with these stretches. I've gone online, I see this and that, but I don't know what's right. So they're going to give you a place to start and build off of that. And then they're going to do exactly what we've been doing this last 30, 40 minutes, and that's teaching posture modifications to reduce that stress on your spine. There's several different modalities that are used for pain relief. I'm sure some of you have heard of electrical stimulation, dry needling, and of course, hands-on manual therapy approach. So here are a couple exercises that we are going to go through. Here's just a quick do's and don'ts, proper footwear. Just like our aging spine, your shoes can age as well. Sometimes I'll see someone and they'll say, I've had the same shoes for 10 years. Well, those shoes are no longer going to provide you as much support as they could. Or wearing sandals when you're going for a long walk, all these different things, are things to think about. Aerobic exercise, low grade aerobic activity is one of the most important things we can do. It's actually shown in the study that it helps patients with fibromyalgia. But basically, the reason aerobic exercise is important is because it gets blood flow going throughout the whole body. Different ways you can achieve this are walking in the pool. Truly one of the best ways to exercise. Unfortunately, not all of us have access to a pool though. So other things are walking, and if that's painful, getting into a recumbent bike like I've shown in this picture, or even in the elliptical. Now, a lot of times we're guilty of getting to the gym and thinking, I have to spend at least an hour here to make it count. But then you hurt the next 2 days because of it. Starting out slow, 10, 15 minutes, and increase slowly each week by 5-minute increments. And then the biggest thing from this page would be eliminating the no pain, no gain mentality. Our body has pain to tell us this is not right. What you're doing is hurting. So things can be strong but comfortable, but once you've crossed into that pain threshold, you've taken it too far. Heel slides, this is a good one to do. Gets the hamstring going, gets the blood flow going back up to the heart. It's a good simple one to do if you're in bed after surgery. Here are some pictures of some things we can do. You guys could be doing this right now. Posterior shoulder roll, rolling shoulders front to back. Scapular squeezes, where you squeeze your shoulder blades down and back. Pretend there's a grate back there between your shoulder blades, or raisin, and you're holding for a couple seconds. These are good things to do even during a meeting. Doorway stretch, truly love this stretch. If the doorway is too aggressive for a shoulder joint though, you can go into a corner to do this stretch, although corners are surprisingly difficult to find sometimes. If the corner stretch still aggravates that shoulder or sends nerve pain, traveling pain down the arm, lay on your back and just let your arms fall out to the side. But the reason that one's important is because it opens up the chest. It reduces that forward head posture that we get into that's so aggravating to our neck. The far right, the piriformis stretch, this is such a classic stretch. Your nerves start in your low back and then they go through your buttocks to the rest of your leg. So everything converges into that one area and turns into that sciatic nerve, which I'm sure many have heard of. The sciatic nerve is as thick as your finger, so it's big. And if that one is aggravated, it's going to really aggravate the musculature around it. Approximately 40% of us actually have that nerve pierce through your piriformis muscle. So you could see how that could be greatly affected by that. Ankle pumps, this is a great exercise. It seems so simple, but it really is good. Again, especially after surgery, reduces your chance of a blood clot in the calf. Your heart pumps blood away because it's a muscle, and that's wonderful, but your veins are a one valve system. So anything you can do exercise wise to bring that that blood back up is going to be good. And last but not least, gluteal squeezes. Gluteal activation is actually very important. When you're walking, we all need about 10 degrees of hip extension where our legs coming back behind us. And if we don't have that strength in our bottom, you're going to compensate in ways you're not even realizing. You're going to start to hyperextend your back or side bend to one side because of that weakness. Here are some exercises that you can look into. They're located on our website if you have further interest in that. But the biggest takeaway from today is that what we teach you is only 10% of your lives, not even. What you do on a day-to-day basis, from beginning of the day all the way to your sleeping position at night, is what's going to get you through your recovery or prevent and maintain any symptoms you may have. And that's it. I really appreciate everybody's time. Thank you so much for being here. I believe we're going to take some questions now from Deb.
Thanks so much, Jenna. As a reminder, you can submit your questions. Just type them in and I will be able to go through those and read them to Jenna for her to answer. So we can get started with a few that I've seen so far. How often should I replace my sneakers? I try to walk 3 times a week for 30 minutes while the weather is nice.
I would recommend, everybody's going to be slightly different. That's a great question, but you're going to be safe to replace your sneakers every 6 months to a year. I think if you're doing it at the length and duration that you're doing, you could make them last a year.
Great. Is there a specific type of baby Bjorn or baby carrier that you recommend?
Oh, that's a great question. There is no specific type that I know right off the bat. I would just try to find one that has some kind of lumbar or low back support, and most of them do, where it reaches around to the front and you can fasten it. You just want one that's going to be able to be custom fit to you, where you can fasten the straps, because most likely you'll probably be switching that Bjorn from you to someone else to carry the baby, and you just want to make sure that you can always fit it to you.
What is the best exercise for sciatic nerve pain?
Ooh, that's a tough question. The best exercise for sciatic nerve pain. Without assessing you specifically, it would be very difficult to answer that question. But right off the bat, the exercise that I showed you, the piriformis stretch, would probably be the biggest bang for your buck.
When do you recommend a standing desk versus a sitting desk in my office?
When to recommend a standing versus sitting desk in the office? I would recommend switching. If you have access to both, I would recommend switching between the two throughout the day. So sitting for an hour and then standing for an hour and going back and forth, not all the time. time do we have that option, but that would be the best one.
Can I sleep sitting up on a sofa?
I would not recommend sitting up on a sofa. Sometimes people sleep in a recliner or a lazy boy, and that would probably be better than sleeping sitting upright on a sofa. Obviously, the best recommendation is going to be on a mattress. However, I understand that that's not feasible for some people. So if you had to choose between a sofa and a recliner, based off that hydration slide we talked about, I would choose the recliner.
Okay. Are there any supplements that will help prevent great stiffness in the back in the morning? And if not supplements, then any advice on what to do to not wake up feeling so old?
Oh, that's a good question. I do not have any specific supplements that I would be able to recommend for stiffness in the morning. The thing I would want to talk to you about is, how are you sleeping at night? Do you have a good mattress? On your back, are you using the pillows the way you should be? And then in the morning, if you do still have that stiffness, I would recommend doing a couple stretches while you're still in bed, and then going to log roll out and sit up slowly. And I would also recommend drinking enough water. It's something that we don't pay enough attention to.
Can acupuncture help with back pain?
Can acupuncture help with back pain? Well, we actually participate and provide in dry needling. And dry needling is acupuncture-like needles. So it's the same needles as acupuncture with a different therapeutic intent. We find that has been very beneficial towards our patients and clients for the last 10 years that it's been a part of our practice. That's a great question.
For people who are fully recuperated from surgery, is there a website showing more advanced abdominal exercises that aren't harmful to the back?
Do you mind repeating that one more time, Deb?
Sure. For people who are fully recuperated from surgery, is there a website showing more advanced abdominal exercises that aren't harmful to the back?
Okay, good. So they wanted to know what are some good advanced core exercises. Actually, we did create a core exercise page that's going to specifically answer this question. If you go to our Mayfield website and go in there, you'll see that there is a core exercise page. It should be listed under health topics.
Okay. Are bridges good for sciatica?
Are bridges good for sciatica? Bridges can actually be a difficult exercise. It's not for everyone. If you do your bridge and it's pain-free, then I would say go forward with doing the bridges. However, if you're doing a bridge and you're trying to force past that pain, do not do it. You're better off just starting with some bottom squeezes first to get that activated.
Okay. What is your favorite pillow? And do you recommend, which type do you recommend to support your neck?
I wish I had a favorite pillow. I get this question a lot. I truly don't, because everybody's just so different. You can get any kind of pillow. You just basically want to get into that neutral position. So if you're on your back, you almost want to pretend that you went straight from standing with good posture to laying with good posture, just to fill that negative space. You don't want your neck too far forward or too far back, or if you're on your side, too kinked to one side.
Okay. Can scoliosis be fixed or corrected through physical therapy?
Scoliosis cannot, if you actually look at the true scoliosis, cannot be fixed or corrected through physical therapy. However, like we discussed with that muscular support, we can find ways to potentially manage it by stretching different areas that are tight, strengthening different areas that need it.
Okay. What type of lower and neck support would you recommend?
What type of lower and neck support would you recommend? So I hope I'm answering this question right, because I'm not quite sure what you're asking, but if you are going to provide lower back support, anything like that rolled up towel would be good to put it right underneath that small spot in your back. If you are looking for neck support, you could look into getting a upper extremity posture brace. You can find those on Amazon, and that's going to bring your shoulders back and reduce the stress on your neck. And again, I apologize if that wasn't the direct answer to that question.
Okay, great. Are Tempur-Pedic mattresses okay or bad for back issues?
Are Tempur-Pedic mattresses okay or bad for back issues? This is not a one blanket fits all type situation, no pun intended. But if you feel comfortable on that mattress and you feel like you're getting a good night's sleep, then chances are it's good for you. If you feel like it's not working for you and you've had the same mattress for over 10 years, you may want to look into getting a different mattress.
Okay, great. I have a job where I'm on my feet all day. How long would you recommend standing versus sitting to rest that in order to prevent back pain and neck trouble?
Yeah, if this kind of goes back to that other question, but I would recommend alternating every hour between standing versus sitting. But if you feel like you can only stand for 30 minutes and then you start to fidget, then sit back down.
Okay, great. I have tried yoga and Pilates for about a week and still have lower back pain. Not severe, just aching. Should I give it more time or call physical therapy?
That's a good question. Yoga and Pilates are wonderful exercises. However, sometimes we can push ourselves a little bit too much in these exercises and end up maybe rotating too much or bending forward too much. I would recommend going to see a physical therapist for your low back aches. And then that way they can tell you what's the correct way to move and they can better educate on what is right for you specifically.
Great. I just spent the weekend doing a lot of yard work and now I'm sore. Can you describe some of the best stretches to relieve this back pain?
Sore from yard work, some good exercises would be going back. Again, I would like to see and learn more about you and to see exactly what's tight and what's not. But going back to that piriformis stretch that I showed you would be beneficial. And, you know, icing it, a lot of times we forget about icing our low back, and it's the cheapest anti-inflammatory on the market. So don't be afraid if you flared yourself up to put ice on it, rest it, give yourself, you know, a good couple days to kind of recover from that.
Okay, great. Looks like we have one more question. Is holding your stomach in good for your posture?
Holding your stomach in is good for your posture if you're doing it the right way. Make sure you're not like sucking in, but you're bracing, you're gently firing that core muscle. And it's good to do in different positions. You know, when you're reaching for something, turn that core on. You know, when you're sitting there, turn the core on. If you're going to lift a child, turn that core on. So yeah, that's a good question.
Okay, looks like we can do maybe two more. On that note, is planking considered an effective core exercise?
Planking's a great core exercise. You probably only need to do it for about 20 to 30 seconds though, and go for 2 to 3 reps. If you feel like you're not maintaining that good spine alignment though, when you're doing it and your back's kind of dipping down, or your shoulders are dipping down, then maybe only doing it for 5 to 10 seconds. We're always going to choose form over quantity.
Okay, great. On that note, is it okay to still weight train with dumbbells and such while going through physical therapy for bulging cervical discs? Are there any specific exercises to avoid for this condition?
If you are going to physical therapy, I would defer that to your physical therapist, whether or not you can use that weight equipment with your bulging cervical disc. It goes back to the no pain, no gain. Don't go through pain. And I would definitely avoid anything overhead, especially with any kind of weights in your hands.
Okay, great. Thanks, Jenna. Okay, I think this will wrap up our question and answer period. Again, this webinar has been recorded and will post on our website shortly. So be sure to tell your friends or anyone that you think would benefit from this program. If you enjoyed tonight's presentation, please register for our next installment of Spine Talks, which is on October 20th with Dr. Mike Cashman. For more information about future Spine Talks webinars or the work of the Mayfield Foundation, please visit mayfieldfoundation.org. Again, I'd like to thank everyone for joining us. Thank you again, Jenna, and hope you have a great evening.